Hello everyone. Today we will be presenting on transient ischemic attack. This presentation is by Tori, Jules, Tatiana, Kellyanne, and Max.
So there are two major sources from which blood enters the brain. Anteriorly, we have the internal carotid arteries, left and right, and posteriorly, we have the vertebral arteries, also left and right. Now, in this anterior section, we have kind of a branching to form anterior and middle cerebral arteries. So in the right-handed side of this image, you can see those arteries on the cerebrum kind of dividing throughout. Now, the internal carotid and vertebral arteries are actually connected by this structure called the circle of Willis, which is kind of a circular artery in itself. It is very redundant, so basically if a cerebral artery fails to supply blood or something goes wrong, the circle of Willis acts to back that up. However, if the circle of Willis itself fails in some way, we can see many problems arise. One of them is actually ischemia or reduced blood flow. So, common causes of ischemia, the main one we have here is atherosclerosis. We'll kind of get into more risk factors later, but atherosclerosis is basically a buildup of plaque in the artery wall, and there are two main possibilities here. We have the narrowing of a vessel and a blocked blood vessel. So with narrowing of a vessel, plaque starts to accumulate in the artery wall with this atherosclerosis, and this makes it very hard for blood to get through and reach the brain. So typically what we see is chemicals in the body will actually degrade this plaque, so it's really only a temporary issue. With a blocked blood vessel, we have either a piece of plaque that we just talked about breaking off and getting clogged in a vessel, or a platelet or a blood clot itself just getting clogged in a vessel. This also is typically a temporary issue. The blood will kind of push this clog through and it will resume its normal path. However, with both of these, blood clots temporarily reduce blood flow, and this will limit oxygen and nutrients being received by the brain.
What is it?
A stroke occurs when a blood clot gets lodged within a blood vessel in the brain, which then will cause that vessel to rupture. Now, there are two primary reasons for ischemic stroke, one of these being thrombotic. This means that a blood clot forms within the blood vessel, which will eventually disrupt blood flow. The second reason is embolic, and this means that the blood clot forms somewhere else in the body, travels to the brain, and eventually disrupts the blood flow there as well. In a transient ischemic attack, areas of the brain are not getting enough blood, and thus, the cells go through ischemia and die. It is called transient because this only lasts for a few minutes. Symptoms usually go away within an hour. However, in rare cases, these symptoms can last for up to 24 hours. A transient ischemic attack is usually a precursor or warning for strokes in the future.
Risk factors. What are the risk factors for a transient ischemic attack?
The risk factors include elevated blood pressure, smoking, and excess alcohol. They also include obesity or being overweight, elevated blood cholesterol, diabetes, family history, age, or having had a prior ischemic attack. It's important to note that while some of these factors, such as smoking and excess alcohol, are controllable, others, such as age and family history, are not.
Signs and symptoms. Some of the signs and symptoms for a transient ischemic attack include weakness, numbness, or paralysis, dysarthria, amaurosis fugax or TMB, vertigo, dysphagia, and abnormal senses. Other signs and symptoms include confusion, severe headache, memory loss, altered level of consciousness, and passing out. Preventative treatments. 8 ways to prevent transient ischemic attack.
One of the easiest ways to prevent TIA is to exercise regularly. It has been proven that exercising for a minimum of 150 minutes of moderate to intensive activity is effective in reducing systolic blood pressure. Another preventative measure is to quit smoking. Smoking and long-term exposure to secondhand smoke can damage the inside walls and arteries. The damage can allow deposits of cholesterol and other substances to collect and slow blood flow into the coronary arteries, making your blood more likely to clot. By eliminating smoking, you can significantly decrease your risk of TIA. Along this line, limiting alcohol consumption can also decrease your chances of TIA. Excessive alcohol consumption can lead to weight gain, high blood pressure, and irregular heartbeat, all of which can increase your risk of having a TIA or a stroke. It is important to eat a low-fat and high-fiber diet while being careful to reduce salt intake. Cholesterol is a fatty substance that can be absorbed from foods. There is too much cholesterol in your body, it can cause fatty deposits to build up in your arteries and restrict the flow of blood. However, eating well can reduce your cholesterol level. Other than lifestyle changes, there are multiple ways to prevent TIA with medicines. Medicines like aspirin and antiplatelets reduce the ability for platelets in the blood to stick together and form blood clots. In serious conditions, one can undergo a carotid endarterectomy, which is a surgery which involves removing the lining of arteries and all of the blockage inside of them to prevent future attacks. In almost all cases of a patient having a stroke, they are prescribed blood thinners. Using blood thinners and anticoagulants as a preventative treatment decreases the chances of blood clots forming in the heart, which reduces the risk of stroke. Just as crucial as the other preventative treatments, early detection is severely important in those with TIA. 1/3 of people who have experienced a TIA will experience a full-blown stroke. In order to prevent this from happening, it is important that patients seek medical attention as soon as possible.
Thank you for watching, and I hope you enjoyed our presentation on transient ischemic attacks.